Good morning. Welcome everyone to our July 27th, 2021 Board of Commissioners meeting. Our first order of business, will everybody stand and join me for the pledge.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, thank you everyone. Bob, agenda review.
Mr. Chair, there are no changes to the agenda today.
I'll move the agenda.
Second.
Got a motion and a second for the agenda. Is there any questions or comments? Hearing none, all in favor say aye.
Aye.
All opposed, the motion carries. First item on our agenda is planning and zoning. Welcome. Mark or George is taking all of it today.
Morning, everyone.
All right, morning, George.
It's no longer required by the county board.
We had a long discussion on that. So what would be the process then? Wouldn't even vote on it or nothing? Just no
Correct.
action. Okay. That's a lot of work for them to go through all that with you guys, but okay, well, good for them.
PC 22-21 is a request from Blue Earth County. Is a request for review and approval of amendments to the Blue Earth County Code of Ordinances, Chapter 6, Article 5, Subsurface Sewage Treatment Systems, Section 6-436, Transfer of properties with existing septic subsurface sewage treatment systems. Staff presented the report. There was no public comment. The chair asked the Planning Commission for comments. One of the members stated the amendment reflected the comments provided by the county board. Others indicated they had no questions or comments regarding the proposed amendment. Following the discussion, the Planning Commission forwarded a recommendation for approval of the amendment based on the findings prepared by staff, and the board action is the adoption of the ordinance amendment.
Thank you, George. At this time, we'll open this up for public comment. This hearing is being recorded, so please state your name and address for the record. Please limit your comments to 3 minutes. For those participating via Zoom, you can unmute your line by clicking the microphone button on the phone, *6. So anyone wishing to testify on PC 2221 for Blue Earth County, please state your name and address for the record. Anyone wishing to comment on PC 2221 Blue Earth County? And last time, for anyone wishing to comment on PC 2221 Blue Earth County, the subsurface sewage treatment system, please state your name and address for the record. Seeing, hearing no public comment, I'll bring it back to the county board for action.
Move to approve.
I got a motion. Do I have a second?
Second.
Second. Any discussion? Hearing none, all in favor say aye.
Aye.
All opposed? Motion carries.
PC 23-21 is a request from Blue Earth County for an ordinance amendment to Chapter 24 zoning, Article 3 district regulations to change the process of transferring residential development rights from a conditional use requiring approval by the county board to an administrative review by the planning agency. Staff presented the report. The chair asked the Planning Commission for comments. Members indicated it is a good amendment and they had no further questions or concerns. Following the discussion, the Planning Commission forwarded a recommendation of approval of the amendment based on the findings prepared by staff. The board action is the adoption of the ordinance amendment.
Thank you, George. At this time, we'll be opening up public comment. If anyone would like to comment, please state your name and address for the record at the podium. If you are on Zoom, please use *6 to unmute your phone to make your comments. So at this time, anyone wishing to comment on PC 2321, please come to the podium, state your name and address. Anyone interested in commenting on PC 2321 for Blue Earth County Ordinance Amendment? And last time, anyone wishing to comment on PC 2321 Blue Earth County transfer development rates? Seeing no public comment, I'll bring it back to County Board for action.
Move to approve. Second.
I got a motion and a second. Any questions or comments, discussion?
Mr. Chair, what's the appeal process? Is there one?
The appeal process to start the transfer of development right?
Let's say
Procedure.
that it's administratively done and people disagree with it. What's the process?
Okay, now I'm with you.
Okay.
I thought appeal as if it was denied or something
No.
like that. Okay, so as you may know, our electronic permitting program is called City. And so there would be a formal application that would be submitted, entered into the City View program. An application printed out from that goes through a review process by the planning agency, and assuming that all of the requirements are met of the proposed amendment, a decision notice would be issued and that transfer would take place. So it's like I'll equate it to a permit application, but it's for a transfer of development rights.
And I understand that, but let's say somebody disagrees, let's say you deny it.
Okay.
What's their process?
So there is an appeal process from that perspective. It's similar to a construction permit within a vacant quarter section. They may have 2 parcels of land, neither of which may be a parcel of record, and it's on a first come, first served basis. We did talk about your concern in the appeal and no notice to neighboring property owners, but we thought that the likelihood of that is relatively small, and if that does become an issue, to consider a further amendment to the ordinance.
I guess, I think an appeal process is important.
Yeah, and we don't have an appeal process in place right now,
Yeah.
technically, with the CUP.
Yeah.
If we deny it, we deny it.
Sorry to jump in here.
Nope,
but
go ahead, Mark.
Just to address the question.
Yep.
Typically, whenever there's a decision by the planning agency that needs appeal, that would go through the Board of Adjustment process. And so that process would remain whether it was in this case or a construction permit that they didn't agree with. But once the zoning administrator, that planning agency makes that decision, if that's, there's a disagreement, then that can be appealed to the Board of Adjustment. We did set that up on our fee schedule last year for the appeal process as well. So I think we're set in that regard.
Okay, thank you.
And then after it goes through the Board of Adjustments, it doesn't come back to us.
I
That's the
know.
final approval. Then it
That's
goes to
final.
district court if they want to challenge that, so.
I was just curious about the
Yep.
process.
Good clarification, Clean. Because this is usually a relatively run-of-the-mill
Yeah.
application, but about the time it doesn't work is when we run into problems. So we're very supportive of this at the board level, or at the planning and zoning level especially, because this is a lot of staff time goes in it. But I do want to reassure everyone that just as much effort is going to go into this. It just ain't going to go through the boards. You guys will look at it at the same details you do now as if it was coming through for a CUP, so.
And we do track when a TDR is completed, whether it was a CUP or moving forward. We do track those on our mapping program and those things so that
Good.
we have record of those.
Okay.
I think it's a good process.
Yeah.
I think it makes sense. I just was curious about it.
Expedites it for the landowner.
Yep.
It can be up to 2 months by the time you get everything if you miss a day or something, so. All right, any other questions or comments? Hearing none, I got a motion and a second. All in favor say aye.
Aye.
All opposed? The motion carries.
Thank you.
Thank you,
Thanks,
George.
George.
Thank you, Mark.
Thank you.
Good day, guys.
Thanks, both.
All right, our next item is Craig Gossenson, our drainage manager. County Ditch 57 repair report.
Yes, County Ditch 57 is located on just the west side of the city of Mapleton. We have a sediment trap pond area that needs to be maintained. It's a scheduled maintenance every 8 to 10 years, 8 to 12 years, and it's been 10 years, so it's due. So.
Okay.
And the engineer's estimate for the repair is $29,200.
Okay, do I have a motion to accept the repairs?
Second.
Got a motion and a second. Is there any discussion? We have enough money in the account, Craig?
Yeah.
Okay.
Mr. Chair, I guess I would just mention, the system worked. This is what it was put into, designed to do. It's done what it was designed to do, and the system is working, and this is one of those, part of that system. So-
Actually, it's working better than we expected it to. So it's great.
And there was a lot of controversy over this ditch when we went to put it in, so.
And it was a newer concept.
Yes,
At that time.
very
It's-
much so,
It's
very much so.
much more common today than it was.
That wasn't that long ago, was it?
Oh,
Yeah, 10 years ago. is when
10
it
years
was.
ago.
2000.
That's what I'm saying. That
Yeah,
goes by.
2012.
okay. Any other questions or comments? I have a motion and a second. All in favor say aye.
Aye.
All opposed? The motion carries.
Thank you.
Thank you, Craig. Next item we have is Phil from Human Services.
Morning, Phil.
Good morning, Phil.
Morning, Phil.
Morning, Phil.
a nice picture of the sheriff on the yellow line.
Oh, yes, it is, isn't it? Brad will retire someday, but never his image will be forgotten. Mr. Chair and Commissioners, thank you for hearing Human Services report today. I do feel that tug always that I represent, all those employees that work for you, and so thank you for listening to what we're up to. I do have one action item for the board's attention, and that's regarding supportive housing. Hearth Connection, it's our provider contract. You've seen this come several times prior. It serves the 8-county area, and in the narrative, those are listed. This is an addendum to the base contract from 2020. I did include some of the history of the funding. In 2019, $423,000. 2020 went down a little to $417,000, and we're back up again to $437,358 for this year, and that is an increase of 4.8% from the prior year. It directly relates to our expenses, staffing, and projected cost for new enrollments. This service does include youth, individuals, and families, all who are experiencing long-term homelessness in any of those 8 counties. The term of the contract, January 1st of 21 through December 31st of 21, and you'll see the note below. There was a very significant delay from Hearth Connection's end with regard to getting the contract. One of those was technical, and that they went through a new electronic contracting system, and then also they went through some very significant internal administrative changes which delayed this. So that is the reason for us bringing the contract for this year halfway through. That's the only action item I have.
All right. Do I have a motion to accept
So
Bill's
moved.
action item?
Second.
Got a first and a second. Any discussion? Hearing none. All in favor say aye.
Aye.
All opposed? The motion carries.
Thank you, Mr. Chair. Board, we have several informational discussion items. The first of those is a packet for the yellow line with the sheriff on the cover of that. I do want to go over this. I know several of you were at the MSSA breakfast meeting last week, and so the material that Matt DeRose from the city presented is really off these slides, but I do want to just highlight some of the big areas once again for the record, just because we do bring this at least once a year to update you. The 2020 and 21 status, we did get the care coordination approved as an MA covered benefit, which was a big effort with a lot of red tape, to be frank, and our rate is very low, but we do have a foot in the door, and we did get a retroactive payment. The amount will be a few $1,000s probably, but we do feel like we're on a track to have an ongoing sustainable funding source, which is a major accomplishment. And then also we're chasing anybody who's been in detox. We had went through Pat's office to make sure that that it's okay for us through the billing mechanisms that we have to kind of reach out to people who go through detox, see if we can't help them. So we improved the workflow in that regard. Became a mentor site. I think the board's heard this, and that are for teams across the U.S. We have had one, well, maybe 2 that we've done so far, and we have another one in the queue that we're working with now. They're really efficient. We do them through Zoom, and they ask questions, and a lot of them are at operational level, and so I think it's mutually beneficial to compare notes with some of these other teams. The collaborative outreach team efforts. This is actually a really important piece of Yellow Line. It's the multidisciplinary team that gets together and talks about cases. Matt DeRose talked about how we all have different rules we live by as far as release of information, and the cops are probably the ones that can speak most freely based on their records. We're very protected in what we can and can't say, so we always respect that. Try to get releases of information if that can help the service we're providing to these individuals or families. And then the final bullet on that page is just the impacts of COVID, which really did decrease our ability to screen and to follow through with some individuals, but then we've more than doubled so far from that low spot in 21. So things are back rolling again very significantly in regard to volume of Yellow Line need. excuse me. The second slide is pathways. I'm not going to go through that, but certainly willing to address anything. Our different pathways that we have at the street level, pre-booking, and then if somebody is incarcerated, if there's a way we can intervene early in that process and get them back out into the community and getting the services that they need. The next slide is the primary focuses, 3 that we've had that haven't changed: access to service, increased engagement, and reducing jail bed days in the project itself. The next slide has some of the data for 2020. 630 individuals were screened, 214 were referred, and 76 engaged. Again, that was highly skewed by COVID, but still a pretty good group of individuals. We knew we weren't going to serve everyone or even half of everyone. We were going to try to target people that really wanted help, that we could help in a more intense level. Summary data also not new to the board, but that we are finding 80 to 82% of the screened individuals are self-reporting that they have mental health or chemical health needs. And the long-standing belief is the jail population is 30 to 50%. So we're seeing year after year a much higher incidence of need in both chemical and mental health, which in some ways is not surprising, but I do think it matters when we have a plainclothes social worker asking some of those questions. People are a little more forthcoming, so that's one of the things we've learned. 48% of the participants were successful in completing their whole YLP plan. I can tell you, just coming from the chemical dependency realm, that 33% is a third, pretty stable figure as far as people that go through treatment, as far as stay in recovery for up to a year. And so it's a good number, even though we'd like it to be higher. And then 67 had no further law enforcement contact within 3, 6, and 12 months. The next slide is a very busy slide, but I do think it's important to show you in that in order for us to claim that, we have to track people kind of in the month that they presented to us. Otherwise, we're comparing people over time to other people over time, and that doesn't work. It's not a statistically good way to try to measure. And so these cohort groups we track over time, and you'll see this bar chart just in how we measure success. I do want the board to know that MMB, the Minnesota Management and Budget Office, has a arm of what they do to do evidence-based practices and try to look at things that could be replicated with efficacy, both in terms of good business practices as well as good clinical outcomes. And so they've reached out to us in the last 6 months, and Angie and I have had a couple talks with them just about how we can measure this. And what they do is set up a control group in another place where they can pull data. It's very scientific, back to grad school for me. And so we have lots of these talks, and I really do enjoy it. Actually, it's a lot of fun to have these conversations about how can we really actually measure this. So it's a really good thing, and hopefully we'll come away with something valuable as far as some hardcore evidence in a more scientific way than some of the things on the next slide, which seem to be important too. You'll see the line graph just with detox costs, which we will talk about more in a second. And then the second graph is chemical treatment, chemical dependency treatment, which actually has gone down some. I think that's certainly COVID related in this last year. But we knew at the beginning that even if those costs increased, that would be fine if we traded detox in state hospital for actual treatment. We would take that deal. And you'll see again from our high water mark in state hospital that we've been down and stayed down. We were back up in 2020. We had very little community-based access. So, it's all showing itself exactly what we thought would happen. We're seeing it, and like I say, to me, that's some pretty good evidence. It might not be statistically significant, but just looking at it, you're saying, okay, we've got something good going on here. The following slide you've seen before as well. Prior to yellow line, law enforcement was not making referrals through mobile, and we did get a smattering of mobile calls. Since then, we've gotten a lot more overall mobile calls, and law enforcement has been, represented to the tune of about half of those referrals, which is, again, a core goal of what we're trying to do is partner with our law enforcement agencies. So if that's the good news, I might move on, Mr. Chair, to the detox piece. You'll see the next graphic which is kind of separate from our yellow line packet. But the next informational discussion item is detox. And so you'll see through 2020 that those last 4 years, we were very stable and had reduced detox by, at least $100,000 over those 4 years. 2016 was a partial year with yellow line, so those 5 years are significant. We've jumped way high back up, and the reason for that is the jail has changed its front-end screening process. They used to do triage, at the jail as far as who went to jail. What we understand, we've reached out to the jail a couple times, just wondering what's going on, but they are just, if somebody has chemicals on board, they're sending them to detox. That's what they're doing. It's a hard pill for me to swallow, I'll be honest. We've worked really hard to try to get this down, but I understand they have other issues, not my call. And so for now, we're hoping that this could get mitigated in the future. We come up with a different strategy. It's the difference between brokering out the care to detox, which I do need to say, just on my own knowledge, is that it is a subacute setting. Detox really can't do a hospital level of screening. So that's the part that's hard for me. And no, I don't want them to send all these people to the hospital. That's even more expensive. So there's a problem, I understand that, about getting medical clearance. But to have $200,000 to probably $300,000 next year increase in this area is just something I think the board needs to be aware of. And obviously we can talk with the jail about it, but I think they know that they're making this a conscious decision at this point. And so it's causing a ripple that's hard. I have to say that with yellow line, when we had those first few hours of somebody in a crisis having chemicals on board, having law enforcement involved, that's when we want to get in and talk to them. When they get shipped off to detox, we don't have that ability. And so the ripple effects are pretty significant. And again, it's something we're going to have to team as a county, I understand that. But it is a pain point for us big time right now.
I'm assuming we're looking at what options there are. And I don't know what they are by any means, but... Right.
So, we talked at breakfast this last week about the word triage, and I think that's what this is all about. And I would from my chair, look at this and say it's a non-triage model. We're brokering out the triage to detox who triages. I would like us all to try to triage. That would be my recommendation to Blue Earth County, is that we try to stay involved in that process. So if somebody has a drink and they go to detox, that to me is not a good use of resource. And so how we do that, we're still working on it, Commissioner. I feel like we're in a partnership in this, but a decision was made that had a huge immediate impact. This is a projection, obviously, what you see on the chart, but I mean, the real dollars through half the year, $100,000 over the whole year, $200,000 next year, probably more like $300,000 of additional costs in that way. And it might be looked at as an investment, risk mitigation. I mean, that's the piece that I can't say about the jail practice. I'm not a jail administrator. I don't know about that side.
So my question is, and maybe Pat would be the better one to answer this, is this because of a liability issue with the jail, or, that they're doing this, or is that, what, I mean, and are we having a cost savings at the jail for them not being in the jail? So, I mean, is it ending up to be even for the county, even though we're sending them to detox when, I don't know. I mean, that's...
So I know, if you don't mind, Pat, and anything you have to add, but I do know that the jail, right from the jail, we have tried to reach out and talk about this issue. They are saying it is a liability issue that they're concerned about. So there's no doubt about that. That's reported just from jobs.
In a lawsuit for some, I mean, lawsuits are going to cost us millions.
Right.
So, I mean, that's, I get it.
And then to your dollar-to-dollar question, I can answer that. Detox is $433 a day, 2-day stay, almost required, so it's $8, $9, close to $1,000. Jail's $150, $100 a day, so it's much more costly. There's no doubt.
You covered it, Bill, thank you.
So I mean, we will stay engaged. I guarantee you that. But it is a little bit of a ripple right now that we're going to have to try to work through if we can. The next piece, I have two more, and then I want to talk, Kelly did give me some notes just about COVID and get the board updated on that. This last one about project management, it's something we're pretty proud of. I brought these year over year as far as how our platform looks with regard to human service project management. You'll see that we track our estimated times to complete projects, and if you add the by the due date and prior to the due date, that's about half of our projects that we get done either early or on time. And then the other half is late, which, you know, I'm certainly from my chair okay with that if there's good reason. We track it, we discuss it, we have to approve it. So there's a lot of looking at that. And then you'll see the second pie chart, both very simple charts, but just level of effort. We try to look when we go into a project, is this a small, medium, or large project? And then we also do some triage on the on-deck projects that we're wanting to do, but we're either full with regard to resource or there's a reason to wait a little while before we implement. And then park projects are more defined along the lines of good ideas that might happen someday. It's an interesting triage process because the park projects, sometimes you sit and look at them for 6 months, and then after 6 months you go, I don't know about that one. So there's a kind of a natural weeding out that happens in this. And then I just asked staff to give us some examples. I won't read through all these, but just some of the completed projects, like what is a project? And so those are the titles. I understand some of those are in acronyms and other things, but just to give you some idea that it kind of goes across the gamut of direct service, infrastructure, some of our liaison stuff with IT or HR that we work on at times. And so there's a smattering of all kinds of things. And then the active projects that we have now are listed, and then the on-deck and the parked as well, just to, if you're interested in any of those. And I'm certainly, if you're wondering about any of them, I'm certainly glad to do my best to talk about those. It is interesting because some of those I probably wouldn't have a whole lot I can tell you because I'm not either directly involved. We meet regularly and I'm always part of those meetings, but there's kind of those champions that are in charge of the project, and oftentimes they're pretty technical. And so I'm quick to delegate those to people that are smarter than I am in those ways. So.
Mr. Chair, how are we doing with foster care parents?
I would say okay.
Okay.
Yeah, but not, I think we have an ability to draw more just because of the size of our county compared to our neighbors, generally. Mm-hmm. I do think it's a very thankless mission, meaning that you don't do it for the money,
No.
So that's always the issue. And I have just tons of respect for, we've tried to get foster parents here and recognize them when they retire, and that's happened a few times, but most of them are such humble people, to be honest with you, like, no, I don't want any of that. I did it for a reason, and that reason's been accomplished. So I think they're lifeblood of, like, when we look at out-of-home placement, which is always an issue, and it is this year, and it will be next year, but that saves us that we have. Foster care is the best option by far, and we do recruit even off the website, just that general intake comes to me, and Tacey kind of sorts for me. But we get a lot of inquiries about people that are interested in foster care. So we take those as very
That's
important
great.
leads, and we follow up right away. And there's classes that they can take that inform them what they're getting into. And so all of that's pretty solid as far as that goes. I wish we had more. Even this question, if anybody's watching, anybody, if we know anybody that might be doing this. Sometimes, I always say every 5 to 10 years we kind of have to remake ourselves. And you get into a chapter of life where you're like, I don't know, I kind of wish I could do something. And there's a lot of, you can take short-term, like infants, and say, I don't want it long-term, I'll just do it kind of on emergency respite kind of level. And so anybody that would want to do this on any level, we're kind of constantly marketing that need because we're not flush. I don't want to come off as saying we're all good. I'm saying we're getting by, we could use more. Yeah, for sure. Yeah.
I was just curious.
Yeah. Thank you.
We appreciate the people who do that
my goodness,
immensely.
Yeah, it's one of those that you really can't find words for it. We're very dependent on it, and I wish we were our bench strength was even stronger, but we do have some families that have just put themselves in that trench and stayed there, so we really appreciate that very much. I have talking points here from Kelly that she tries to do them so they're pretty temporal. So I do need to kind of go over those verbally with you, but our percentages of residents over 16 that at least have one dose is 66%. I'm sorry, 61%. The state residents is 66%. So we lag a little bit behind the state average there, but I think it's a within range kind of number. We continue to partner with MDH and other community partners to increase vaccination rates, prevent additional spread. That is our core mission, especially to individuals at high risk for severe disease or those in congregate living situations. A couple of target areas: the jail. We have an ongoing offer to vaccinate any inmates that are interested. They just need to notify public health. Jail is very aware of that. University and colleges, we are gearing up already for clinics that are planned in concert with MSU for returning students both in August and September. So that's another target area, just so the board knows. And Open Door has been another key partner where we've been able to support and help some of their efforts. They have been involved in some community events and also targeting some underserved populations in both the county and the region. And that's an area where, even though we have a Blue Earth County mission, we're certainly more than willing to try to help regionally in that regard. The next section Kelly has is partnering and support. When people say, okay, so you partner and give support, what is that? So we actually give vaccinations still. It's on a much smaller scale, but we're still going out and helping provide staff to actually offer the vaccinations themselves. We have supports to help with registration. If another partner is sponsoring the clinic, then we will help with registration. Coordinating client access to register for appointments, so that's the prep mod, the prior to ability to try to get people signed up and track them. And then supplemental supplies and syringes. I know with Open Door we did provide a number of those syringes to Open Door, and they were very grateful for that, and so that was a good thing. We hope to move from a response lens to a managing an infectious disease lens. So we monitor and look at, of course, the confirmed cases, and then the variants, which I want to talk about a little bit. And the one that's been in the news the most is the Delta variant. Kelly clearly states current vaccines do protect against the Delta variant. That is true. The variant, though, is more infectious than the other variants and is spreading very quickly in the unvaccinated population. So that's really the distinction about how that variant presents. Epidemiologists at MDH, along with our healthcare providers, are monitoring the situation in Minnesota, and they're updating local public health as needed. She gave me a bunch of then clinical information, which I read last night, and a couple of points that I pulled out of what she provided. That there was a statement from MDH saying that we should all assume that the variant is represented throughout the state of Minnesota. It's not that it's not here, but it is throughout the state. They sequence the variant, so in order to figure out which is a Delta variant, they actually have to do lab tests that are very intricate. They take at least 2 weeks to have results come back, and right now the way they're studying that variant is by a random sample. So they just take a bunch of different people that have had COVID, and they drill in deeper into the DNA to decide to determine which variant we're talking about. And so that's what takes the time. We've had 3 cases in Blue Earth County of the Delta variant, but that's statistics since 2020. And we can't, no one can say, and that's increased with the last 3 cases in the last 2 weeks. They do not track that way. They're not going to track that way because the data would be skewed. It's because they random and just pull out. You can't make the inference, well, it's increasing or trending up or down. Overall COVID they can, but with this variant there's much more science that's needed in order to really pin that down. So data is not posted by variant. Involves the clinical process. I talked about that. So those were my notes regarding COVID update and a little more on that Delta variant as well.
Mr. Chair, just a comment. I know you can go to Hy-Vee and you don't need an appointment, you can just get it. And I think that's really good. And I noticed Nicollet County is doing noon to 2, Monday through Friday with the J&J.
Good.
And So I think that there's opportunities for people to get it. I know that there's still a lot of resistance, and that makes me nervous because
Yeah.
the people who are getting sick are unvaccinated primarily, as I understand it.
Right, correct. Yes, and there's no doubt that that is the fact, that I think people that have been vaccinated have been, some have gotten sick, but there's no doubt that the numbers are about unvaccinated people by far. That's a fact at this point. I should tell you, we have a joint powers board with IMTRAC, so there's 5 counties involved in that, and we talked about a letter that's going to be sent out just encouraging folks that are either have had 1 dose and need another dose, or that haven't had the vaccination, just encourage them to do that. We understand there's, individual rights that come into that picture and other things, but there's more and more evidence that says that if you don't get vaccinated, I think you put yourself at greater risk, and there's really no doubt about saying things like that. I think that's true.
Well, and it seems to me LA is saying their employees have to get vaccinated or otherwise they can't
Right.
be there.
Right.
So,
Yes. Well, it's interesting, working at a lot of different facilities. Yeah, there's been TB tests and other things that you get on the front end, and there's HR protocols and policies around those things. So I think we're going to see that, especially in the private sector, start popping up, where the expectation is that you're not putting yourself or others at risk, because the staff has, value if they're at work, not if they're not at work.
well, or if they're spreading it
No,
at work.
exactly. Exactly.
Yeah, so,
Yeah.
anyway.
I will say we were going to I was looking forward to do an all-staff meeting this Wednesday, and last night just decided, I talked to Kelly too, and she said, I'd kick it out a month. And so hopeful about trying to get people back together in more normal meetings, but I think because of some of this, we didn't want to be on the front edge of that risk. And so those things are difficult, but I still think wise to say we're not fully out of the woods yet.
Can I go back one more time? The jail.
Yeah.
Let's say somebody has drugs and they're taken to the hospital. Who, are they seen by nurses, by the physician? What's that process? And maybe it's different every time.
Right.
I don't know.
Well, I'm going to beat to death this triage word, Commissioner,
Yeah.
so I apologize. But the triage would be that they look at it from an ED perspective and try to then just determine what kind of risk they're at and what are the symptoms telling them. And the vitals, it might stop with the nurse. If everything's stable, they probably wouldn't pass it on, and you might not even see a doctor. If you do then see the ED doctor, and he goes, uh-oh, your heart's not in right rhythm, I'm going to admit you and put you. So those are all, when I say triage, that's what would happen in a hospital from a non-doc type person telling you how I understand their triage process. I am advocating that we do the similar thing out on the street, so to speak, that the cop is always the first to try to screen, that we can support that either through the jail, if that's an intake door, or the crisis center, or detox. Those are all subacute. They don't have the ability to go to the doc because there is no doc. And so that's when I say it's a subacute setting. They can't hand off, they're going to have to send back to the hospital. I still think that's the way to go, to say, take vitals, see if there's stability that's obvious, and if not. If the person's sitting there and Vance would, I'm sure, say this too, is that, not able to stay coherent, that's a very serious red flag. You can't bring them to detox, even because detox will not admit them. I ran a detox. They won't admit somebody that's not stable like that. It's a waste of the cop's time, and it puts the person at risk. So that's the triage that I think has to happen in partnership. Just kicking it to detox won't solve the whole issue, but I'm fearful that you could say, well, bring everybody to the ED, and I'm telling you, Mayo will come to our next meeting and say, quit doing that. So that's what we're struggling with right now, is it's not an easy solution. I think you really have to do good baton handoffs and really work together, and there is no other option.
Of the people that we send to detox, how many pay for it themselves through their insurance? What percentage average?
It's a really good question. We do have, good statistics on that. Off the top of my head, I'm not sure. I'd want to gander a guess at that, Commissioner. There are surprisingly good revenues or fees that we are able to collect. So most, if they have insurance, most will pay something, is what I can tell you. So I would say over half. The other half, I think you have a mix of folks that are frequent flyers, meaning they've been to detox for many, many admits, and they usually have no resource, as we know. So that's the other end of the continuum. Good payers on one side, folks that are indigent on the other side.
I get
And
it.
then there's some in the middle, but I think it tips towards, you know, a 50-50 split is my ballpark guess.
So, I mean, okay, we're sitting, 2021, we're sitting at $554,000.
Yep.
Half of that's paid for by insurance companies.
Yeah, I think that we'd probably get maybe a couple $100,000, I'm ballparking
Okay.
it, but yeah, I'd say something like that.
So it isn't like the county's getting hit up for the whole $554,000.
Right, exactly right,
Okay.
exactly right, yep. Yeah,
That's important to know, even though it's still a lot of money.
Yes.
I mean, it's important to know that we are, and I know your office is hard at work and trying to get insurances paid.
Right.
You know, that's,
right.
and I know that it's been going on for years. But I think it's important to know that, you know, close to half of this is being paid for by insurance.
Yeah, and I could go and check some of that for sure and send you if I'm way off, but I'm saying, it would be wrong to say very little. I think it's a surprising chunk. But yeah, somewhere maybe around half, and I will check that and see if I'm at all close. In my head, I have like, we were at 386 and there was like $180,000 of third party, so it's not quite half, but that's kind of what I have in my head, I'm not sure.
The problem is that we have frequent flyers.
Yeah,
And those folks normally don't have insurance.
right,
You know, the people that, you know, we have 1, 2, or 3 that take over half of this whole thing.
yeah.
And those folks don't have insurance.
Well, and so that's
and
why,
I get it.
right, and
I
that's
mean,
why it would skew that dollar amount, is half the people might have insurance, but if they're overrepresented, if over time you're overrepresented by those folks that don't, that's what we call payer mix, and that can change. I would say it's prudent for me to say two things. In this case, what I'm here telling you about is about the money, and I think I can tell you that straight from our side of what we're paying, and it went significantly up. The other one that I just have to do, though, is the yellow line track, which is, I think this will prevent us from being able to divert a lot of folks, because once they get to detox, that window tends to shut, is my testimony to you, and it's a dead end
Well,
road.
that's concerning.
Yeah, and so I have two concerns. One is the money, and that's what I'm here today reporting. I'm also concerned, though, is over time, we might not access those people because they're not ours. We're kind of doling them out to another, to New Ulm, and the chances of them coming back around, we're trying. We have all of those offerings out there, but we've talked with Detox. I've talked with the director of Human Services at Brown County. They tend to say, here's the yellow line option if you want it. That's very different than a screening where you sit down with somebody and say, okay, are you really willing to do something different with your life? And so those are, to me, two different pathways.
And isn't the rule of thumb 36 hours, and they're probably not
Yeah, that's
gonna
what we've
come
kind of
back,
seen,
yeah.
yes. And maybe MMD will give us something that I can stand on, and that's our experience, and it's pretty clear experience that we're seeing, that there's this window of opportunity where people are ready. And what I said at breakfast is, it's true for all of us. You say, oh, maybe I'll go on a diet. Yeah, I'm probably okay. After a while, it's like, or it's not so bad. This shirt still fits.
I don't even last 36
Yes,
hours.
exactly, that's right. So it's New Year's resolution effect that I'm talking about, and it is important to try to do what we can during that window of opportunities.
Yeah. My mother did pre-sentence investigations for Ramsey
Oh,
County.
sure.
And if you didn't get them right away,
Right.
they weren't coming back.
Right, exactly. And
It's-
that's a hard pill
Yeah.
to swallow there, so, yeah.
All right, other questions for Phil? A lot of material today, Phil, thank you.
Thank you all,
Thanks,
thanks for
Phil.
the discussion, I appreciate it.
Yep.
And just a comment, the Yellow Line presentation on Friday, I thought was excellent. So thank you for that. And I thought there was good conversation.
Yeah.
My only disappointment was she cut us off.
Yeah.
I don't think we needed to hear from everybody,
Right.
as everybody else there about, oh, I'm doing this, I'm doing that. That conversation, I think, could have gone a lot longer and been much more.
Right,
Well, you took most of the
I got a call.
time,
to leave,
yeah,
so I didn't get
which
to
was all right.
Hear everything, but that's.
No, I'm just saying, then they went around the room and everybody was supposed to talk about
Something else.
something else.
I appreciate that very much, and I do recognize Matt Droz just because he's always willing to do that, and it's interesting when you do kind of stick your neck out, take a risk, try to change the flow of the river, and then have one of your partners, law enforcement, at this time where tensions are high,
Yep.
be brave enough to just sit there and say, this is the future, this is where we need to go, this is working, and I can't tell you how much I appreciate him taking lead on that and really doing the presentation. He did a great job.
You did.
Yeah. Thank you all. It's good to see you.
Thanks.
Thanks, Phil.
All right, that takes us down to administration.
Mr. Chair, the first item is the county board minutes for June 22nd.
Move approval.
Second.
Got a motion and a second for the minutes. Any questions or comments? Discussion? Hearing none, all in favor say aye.
Aye.
All opposed? Motion carries.
Next would be the bills for the 3 weeks indicated.
I move the bills.
Second.
Got a motion and a second for the bills. Any questions or comments that haven't been clarified already? Hearing none, all in favor say aye.
Aye.
All opposed? Motion carries.
Mr. Chair and Commissioners, item number 6 in your packet is the Human Resources Department agenda. A lot of informational items for the board today, starting with the promotion of a deputy sheriff to lieutenant, and then initiated recruitment to refill the deputy sheriff, and in this time we've already filled that position. So a lot of activity around that promotion. And we also had a promotion of a legal assistant to a legal assistant 1 and have initiated recruitment to refill the legal assistant position. We also had a promotion of a disease and emergency preparedness specialist to the program coordinator in the disease prevention and control area. And so we've initiated recruitment to refill that disease and emergency preparedness specialist position. We did fill a public health nurse position as well as a medium equipment operator in the public works area. Also a correctional officer in the jail. And then we had a lateral transfer of a social worker in our child protection area to our intake role. And then filled a social worker in the child protection area. We also had a resignation of a medium equipment operator, so we've initiated recruitment to refill that position. Actually, 2 of those medium equipment operators we filled a medium equipment operator. Then we had a resignation of a property and environmental resources specialist, and so we've initiated recruitment to refill that position. We had a resignation of a human service supervisor and a resignation of a medium equipment operator, and we have initiated recruitment to refill that medium equipment operator. We also had a resignation of a social worker in our supportive housing area, and so we've initiated recruitment to refill that position, along with the resignation of a part-time correctional officer in the jail, and so we've initiated recruitment to refill that. And then lastly, we had 2 resignations of library clerks, and so we've initiated recruitment to fill both of those part-time positions. 3 weeks and a lot of activity.
I guess.
I
Questions,
actually went
comments?
through this with Bob the other day, just wondering why. And they were all really good reasons, so I was pleased to go through that and ask why, and he told me why. Some people had left, and so I'm really comfortable with this. I just thought I'd say that.
It's a lot of activity. Of course, we always are disappointed to lose people, but in this current employment environment, there are a lot of opportunities, and quite frankly, some of these are based on people's desire to either improve themselves or really kind of control how much work they do, and different scenarios like that play out. So it's just a real large variety of reasons for these changes.
It's interesting, at yesterday's detox meeting, of course, on board is the sheriff of Nicollet County and the sheriff of Brown County and then the chief of police of New Ulm. And it's very hard to keep employment not only in Blue Earth County in the jails and the dispatch, but I believe Blue Earth County is still assisting New Ulm, or Brown County with their dispatch. He's down to 4 dispatchers. I mean, you can't run 24/7 with 4 dispatchers. And so there's some, they have, retaining for law enforcement is a very hard thing to do. So especially in some of those positions, like jail and the dispatch. So we're probably doing better than some. I think Sheriff Lang said that he's retaining his okay and doing okay, but payment starts higher than what we're used to. I mean, to keep these people, you have to pay them. And it's just one of those things.
This possibly could be an opportunity for regional dispatch too.
I wouldn't doubt that. I mean, and with the IT that we have nowadays, it's not a bad idea. Problem is sometimes finding locations in other counties that don't have the same abilities we do in Blue Earth County here. So.
And we're lucky we have a larger population base, which makes a difference too.
All right, any other questions on the human resources update? We just had a conversation about what we're going to do and run out of letters, and I guess we figured it out. So,
Yes.
busy time.
Well, Mr. Chair and Commissioners, item number 7 in your packet is a draft of a proclamation to acknowledge County Staff Appreciation Day. The Association of Minnesota Counties reached out to Governor Walz's office to request a proclamation from the governor to acknowledge the great work that county employees did during the pandemic. The governor has acknowledged that work and agreed to designate July 27th today as County Appreciation Day, and so we thought we'd bring a proclamation here for the board's consideration, also to thank and acknowledge the wonderful work that our employees did throughout the pandemic. Even though it's ongoing, we still have work to do in terms of addressing the pandemic, as well as some of the follow-along economic recovery sorts of efforts. But certainly from my chair, I want to express my appreciation for the work of our employees, and thought maybe the board would like to do so as well.
I'll move approval.
Second.
Got a first and a second for the proclamation, and I certainly do agree with you, Bob. It's very well ran organization, and it's due to our employees all the way down to every last one of them. So,
Makes it all work.
Kevin?
Mr. Chair, I too appreciate everything everybody does. My question is, does this meet our March 23rd Blue Earth County guidelines for requested resolutions and proclamations guidelines?
I think it does, because it directly relates to the work of the county. So, yeah, I thought about that as well, that we have not typically done proclamations, but when there is a direct relationship to the work of Blue Earth County staff, that is permissible.
And again, I appreciate that, but it does give others the ability to lobby why their proclamation should be important to the county. And if we, as we open this door, we need to remember we've cracked the door.
We have brought forward proclamations or resolutions related to legislation and stuff that impacts the county's work. So to me, it falls kind of in that same realm of direct relationship to the work that the county performs.
It's something that we have control over to a certain extent, as opposed to somebody wanting us to, not allow yellow jackets in the area and making this stuff up.
I guess, and I'm thinking about the proclamations, whether it's this or retiring school superintendents, or, that list will get long, as, and I certainly support not only employees, but support our policy as well. Thank you.
All right. Any other questions or comments? Got a motion and a second. All in favor say aye.
Aye.
All opposed? Motion carries.
Mr. Chair and Commissioners, item number 8 in your packet is an agreement between the University of Minnesota and Blue Earth County for the provision of extension programs locally and as well as employing staff. And so this is a memorandum of understanding that was before the board previously. We had a work session recently to discuss the elements of this agreement, and so we're bringing it back here for the board's consideration today.
I move.
Second? Mark, second. Thank you. Any discussion or questions other than what we answered at the board work session?
Just a question. Do we ever get any concrete what they do and who does what and out of them? I didn't get anything at the work session, just data and that kind of thing. I'm just asking the question.
Well, we get a report 3 times a year. They all come and report to the Extension Committee. We certainly could have that forwarded to you.
I'm just
It's
curious,
by email. Yeah, we get it through email.
What's the tangible outcomes?
Yeah, we get a report we used to meet once a month, and then that got hard to meet, and so I think we're down to 3 times a year now. But all the staff come in and give a full report, what's going on with the organization, and obviously we hear a lot about the fair because that's a big chunk of their work right now. But
Yep.
so we'll hear about that. But we could have that forwarded to you.
Okay,
I'm sure it's
thanks.
an email form of some sort. Other questions or comments?
Yeah, I guess at our March 18th meeting, we got the 4-H impact report, budget. Ag educator does a specific report, and the staff educator does a specific report. All of them.
Rachel.
Yeah, right, yeah.
Yeah, Rachel does one.
Yep. So, like 15, 16 pages of PowerPoint we can share with the whole
Yeah.
board.
Sounds interesting.
Yeah, it is.
Thanks.
They all do something different. Rachel always has a good report with reaching out to the people that don't have resources to
The SNAP.
with the SNAP program. So it's a very important piece of the program. All right, I got a motion and a second for the agreement with the extension. All in favor say aye.
Aye.
All opposed? Motion carries.
Item 9 in your packet is the June financial status report. So we're halfway through our fiscal year. You'll see our total revenue sits at $62.8 million compared to expenses of $47.9 million. Obviously, the revenues are running a little strong for a couple of different reasons. One being the American Rescue Plan funds that were received, so that was about $6.5 million. Then you'll notice our local tax levy is at 54% of our annual expected amount, and so our first half tax collections were very strong. We also are just generally seeing increases in fees for service. Our local option sales tax has been stronger than anticipated. We had actually lowered that budget line when we developed the 21 budget, but we're on pace to have our highest year ever with the local option sales tax. So good news in many respects. The bad news on the revenue side is that interest on investments are not producing much, and actually the fair market value of those investments have decreased slightly at this point in the year. On the expense side, things are running relatively as planned. The contracts and fees line, again, that's our public works contracts for the most part. I can tell you that we paid out over $5 million in July, so this report will look a little different next month as a result of that. But all in all, sitting in a very solid position halfway through the year. On the enterprise fund, the Ponderosa landfill, you'll see total revenues are a little over $2 million with expenses a little over $1 million at this point in time. Pretty typical for a year in which we haven't had a lot of land improvements or large machinery purchases. The second page of the report then shows our cash and investment balances. You'll see up at the top, the total available funds at $69.2 million compared to a 6-month operating needs of $55.2 million. So again, those ARP and local option sales tax dollars are certainly helping things there. Little further down to the total county funds line, you'll see we sit at $131.8 million compared to prior years more in that $118 million. So those numbers will change as we go through the rest of the year, of course, but like I say, sitting in a good position halfway through the year. Be happy to answer any questions the board might have.
Any questions or comments? We'll get to talk about more of this in a few minutes.
Yeah.
Yes.
All right, that looks like it brings me to the end of my list here. Bob, did you have anything else?
That's all I had for you, Mr. Chair.
All right, we will do commissioner reports. Vance, I think I'll start with you today. You guys can give us some NACO info.
Start with me. Huh?
Sure.
Well, I think we'll go all the way back to July 6th, which is our last board meeting. And actually, after our board meeting, I took off and drove to
That's right.
Washington, D.C. Had my first meeting on Thursday afternoon, and at the conference. It was a membership meeting. It was actually an ambassador meeting. And I believe, Colleen, you were there too.
I was there too. I'm an ambassador too.
Yes, you are. So the next morning, we, let's see here, we started off and we had
Breakfast with the new attendees.
breakfast with the attendees, and then we had our vice president, Kamala Harris, talk to the whole board. So that was our general session on, let me get back here. I went and after that I had a meet up with the had an American Rescue Plan on broadband, and then we had our opening celebration that evening on the waterfront. The next day, on Saturday, I went to a talk on future of county libraries. I had a membership standing committee, and at the same time we had a Minnesota caucus meeting. We voted as a caucus to support Mary Jo McGuire, which is surprising, huh? And you know, after that meeting, I had an Arts and Culture Commission workshop. We had our general session afterwards, and that evening there was a LUCRAC or reception. LUCRAC is the Large Urban Counties Caucus, and RAC is the Rural Action Caucus.
And the board.
And the board. Yeah, that's right.
The board was there.
The
yeah.
board was there, which was nice. The next morning, we had a Rural Action Caucus business meeting, and I was able to present that day to the NACO Board of Directors. And on Monday, we had our general session. I had a meeting on broadband task force meeting. We had our annual business meeting in the election where Mary Jo McGuire won, the second vice president. And then I went to a Central Region caucus meeting, and that was pretty much it for what I did. I mean, it was all of us. It seemed like everything was continuous. There's so much that I missed telling you about, but it was a busy time, a lot of learning, a lot of talking. I was blessed to be appointed as vice chair of both the Rural Action Caucus and also for transportation
Good for you.
committees. So, see what happens in the future. That's it. Oh, well, that was just
That was just NACO.
that was just NACO. Oh, let's go on beyond that, huh? Okay. Let's see. Well, I had a TDS meeting on Thursday the 15th. I had my state transportation plans policy action meeting on the 16th. Let's see here. Of course, we had a work session on the 20th. I went to 1,000,000 Cups on the 21st.
I saw your picture.
Yeah. Really? Oh.
Yeah.
Let's see. And of course, the Blue Earth County Fair started on the 22nd, and Commissioner Papp was there that whole time. I was pretty proud of him. We had a MSSA Region 9 breakfast on the 23rd and I was met there by both Commissioner Landcamer and Commissioner Pifo. Had a real nice talk on the Yellow Line project, and that was all talked about already. So that's, but I think it's something that makes Blue Earth County proud because it's pretty well set throughout, not only throughout Minnesota, but throughout the United States, how well Blue Earth County did on that. Let's see, yesterday morning, I had a AMC roundtable, which was a Zoom, and Julie Tesh from the Center for Rural Policy and Development. I'm sure that, Kevin, you know her well.
I serve on that board.
Yep. And she talked. It was real interesting. And then, of course, we had our detox meeting last night. We talked about how what's going on in detox. Detox actually is doing well, and probably because how much Blue Earth County is sending to them. But they're also talking about redoing their building and upgrading their whole building. Seems like they really need to. They got stuff that's 20, 30 years old around there that's surprisingly that something serious hasn't happened. And then we come to this morning.
All right.
Thank you.
Commissioner. Kevin, I'll have you second.
All right, as already been mentioned, I participated with other commissioners at NACO at the annual meeting. I would just add that I participated also in those events, but the Ag and Rural Affairs Committee, where we heard from the Deputy Undersecretary, USDA Marketing and Regulatory, as well as Senior Policy Advisor from the Rural Utilities Service, and the USDA InterGov Affairs Director. Also, the work session, the fair, I'll talk about a little more. Department head meetings and SWCD meeting on July 8th. I attended Lake Crystal Council work session on July 13th with Ryan as we continue discussions on Lily Trail. I had new commissioner training July 14th through the 16th up in St. Paul, as well as a Blue Earth River Basin policy meeting on the 16th. Yesterday was Rural Minnesota Energy Board meeting. We did that. I've met with staff and others concerning Ditch 56 in Lake Crystal. Certainly a lot of sediment concerns. And others met with the township supervisors of the Lincoln Township Baptist Church. And both calls and at the fair, a lot of concerns in our county ditches with wild parsnip. Upcoming events, one that I want to flag for everyone to make sure you're aware that Blue Earth County Township officers are hosting a District 2 meeting in Lake Crystal here in August, and then there's only 100 or so days left as Farm Bureau State President. I want to invite the entire board, the commissioners, to our Blue Earth County annual meeting on August 5th, as well as our breakfast on the farm we do at LeSueur County on August 21st. Maybe just a little bit more on the county fair, if I might. I appreciate the other commissioners that were there. You know, I've been going to the Blue Earth County Fair for over 50 years, I'm quite sure. But honestly, this is the first time I've spent 39 and a half hours there in 4 days. And if I would have did my math before this morning, I would have invested another 10 minutes a day to, you know, to hit 40. But special thank you to you, Pat, for all the guidance and expertise on how the fair works from an elected position. Well, I think this is important outreach, but not just for elected officials, but as a county. I think it's important that we're involved in that. It's an important investment, not only with people, but also our programs. And just publicly want to thank all the county employees that work there. We had many others that attended, but certainly Extension 4-H had a huge role in our fair. Public Works, not only equipment, but expertise at those grandstand events. It's good to see that. And then I'm going to also single out the Sheriff's Department. It's always nice to have the Sheriff's Department when they want to be there, not have to be there as far as enforcement activities and things like that. But I think we provided a lot of information in not those enforcement actions. Certainly, you know, there was some help with medicals with the heat and things like that, but I think it was a relatively calm county fair. But after spending that nearly 40 hours there in those 4 days, I just want to publicly thank Lieutenant Jeff Ursel, Deputy Bill Davis, Deputy Adam Succo, Deputy Josh Holtz, Deputy Luann Anderson, Deputy Nathan Doby, and probably a special thank you to Deputy Jeff Weiberg. He was kind of the brains between organizing it, set up and tear down. We've kind of worked everything kind of as a group, as a county, as we were in Will's spot. But the other thing that, you know, I typically haven't had a lot of interaction with since retired from the volunteer fire department and stuff, so it's only calling in for burn permits. But we had great help from dispatch, whether it was Sergeant Stacy Vollmer or Sergeant Angie Wicks. Donna Miles was there, as well as Brianna Bedard. I hope I'm saying that right. We were more first names than last names, but lot of interaction. It's good to see. It's good to see county employees there all the time. We have a lot of county employees that have family and their kids, and they just know how to talk to kids. And those messages had a lot of stuff we all handed out, but Sheriff's Office specifically, as far as information and just people being able to ask questions in a non-emergency type situation, and not, you know, no confrontation and things like that. So a lot of things. There are many topics. I think the fair is that opportunity, whether it's county employee or commissioner or a county attorney, where people will feel free to walk up and talk to you on an issue. They probably aren't going to pick the phone up and make that call. So appreciate that. But I will have to say, whether it's there or even calls, I think one of the things that maybe we need to think of, whether it's a workshop or not, but I'm hearing a lot of concern with weed inspectors and in ditches, wild parsnip. You know, it's kind of moved from thistle to this because this is so invasive. Worried about it getting moved into CRP lands, and even just safety of people being exposed to it and things like that. So that completes my report, unless there's any questions.
Thank you, Kevin. Colleen.
Okay, we had department heads on the 7th, and then I left for NACO on the 8th, and I'll just hit a couple things that Vance or Kevin hasn't hit yet. The first day I had the CIO IT symposium that talked about, you know, what's going on in IT, and cybersecurity is huge. I mean, there's no, that was an all-day event. And then we had past presidents that night, which is always enjoyable because you get to see all the people that were, I always call us the has-beens of NACO, but it's always really enjoyable. Some of the additional speakers we had were former Congresswoman Fudge, who's now running HUD, and Pete Buttigieg, who's running transportation. We had Speaker Pelosi.
Yeah, I forgot to.
Yeah, and we also had Mitch McConnell, the majority leader in the Senate. He was virtual, everybody else was in person. I had Finance and Intergov, a lot of talk about, you know, the American Rescue Plan and Treasury and just trying to figure that out. There were a lot of breakout sessions too on Treasury and ERP. We had the board forum where we did the resolutions. The board comes together to do the resolutions after it's gone through all the committees. We had an emergency resolution for the metropolitan statistical area supporting it staying at 50,000. And the day it was supposed to come to the full board or the full organization was the day they said we're going to wait till 2030, which is great. So we didn't have to take up the emergency resolution. Julie Rodriguez, who is Intergovernmental Relations for President Biden. I missed the board photo because I was spending time talking to her about issues that are important to Blue Earth County, which I thought was a better use of my time than getting my picture taken. And she also talked about how much she enjoyed working with the state of Minnesota and Governor Walz, but also Chris Schmitter, who's his chief of staff. So I sent a little note to Schmitter and Governor Walz telling them that she had talked about the relationship and how much she appreciated that. It's always good to do that when you can. Mary Jo got 73% of the vote, yes.
Good for her.
And we had a new board meeting at the end of the conference. So it was a really good conference. And like Van said, I mean, I didn't seem to have a second to myself. Something wrong with that picture. But it was good.
It certainly wasn't a vacation, that's
No,
for sure.
On the 19th, the Marion Cato Area Foundation is doing some focus groups on what does our community need, where are the gaps, what can we do. They're doing 7 of them. I was one of the 5th one, and it was a real diverse group. It was partners, it was KUIC, it was a hospital, it was a school district. So a diverse group of people, and just talked about, you know, our community, and the community is broader than Blue Earth. It's bluer than Nicollet for all intents and purposes. And then they're going to do a report afterwards to see what they glean from these 7 focus groups. So it'll be interesting to see. On the 20th, we had a work session. During this, I didn't get to go to the fair because 2 of my grandchildren had state tournaments. It started Thursday and went through Sunday at about 5 o'clock. So I spent my, when I couldn't go to the fair, I was at a ball field in the metro area. Last night I had Diversity Council. They've opened the application for the director again. So hopefully they'll get some good people to apply. And this morning I had airport commission. And I, of course, forgot 12 was closed. So it took me a little longer to get there. But a couple interesting things out of this, I asked how many of this, we have over 600 students at MSU going through flight. I asked how many actually stay here, and they said it's pretty close to 50%, which amazed me.
Wow.
Yeah, I thought that was really impressive. They've got 55 flight instructors, and it's tough to keep them because the airline's hiring like there's no tomorrow. August 15th is the EAA breakfast. It starts at 7, and it's $10 a ticket. You can buy them at the door if you want. A Million Cups with Yvonne Caribou leaving. Ryan Bessie from GMG is now going to be leading the group that does that. So little change. She's leaving in the middle of August, I think. They also talked about, Ryan Bessie also talked about, they got legislation, it's in committee in Congress, to change some of the opportunity zones, because like on 169, one side's opportunity zone, the other side's not, and so it's hard for business. GMG has hired 2 new people, Courtney Malone, who came from Maple River, to do communications, and Andy Wilkie from the mall is now going to do economic development and business there. August 2nd, the city council is doing a work session at the airport regarding the tower. So that's pretty much all I have, sir.
All right. Thank you, Colleen. Mark?
Okay, after July 7th, we did have the department heads meeting. Next day on the 8th was the RCF board meeting, and that was a virtual hybrid. Our chair had to do the virtual. That was at the new office, in the Brett's building. It was kind of like the break room for CWC when I was there. I think that's basically. But it works well, the price is right. That went well, and with our looking at little changes with RCF, it was working. Then I did have a couple of times with the diversity training that was on the later that day. Diversity training for partners for affordable housing, some of that. And then on the 9th, we had an All Seasons Arena meeting, the first time that was in person. Interesting, talked about a few issues that have been that have been bubbling up, and then just reading this morning's paper that well, some of them didn't get answered right, but because we were looking at another sheet of ice, but then the space for the apartment complex, they don't want to sell any land, and this is all what the city manager pointed out just yesterday in the council meetings. Then also the costs are so prohibitive, and the capital money they have for all their other needs. You don't know when ever get another second sheet of ice there, and certainly limits what can be done at the present ASA, All Seasons Arena. So
that's Walnut Towers, isn't it, that they're talking about?
What's that?
That's Walnut Towers that they're talking about, the apartment place?
No, we're talking about with the All Seasons Arena up by the college.
Okay, I was talking about downtown.
Yeah, that one, they're putting so much money into that Civic Center, I think, more than they realize.
$11 million.
That they need to, everything, it seemed like.
Yeah, that was pretty amazing.
Yeah, it was that was a surprise. Then, let's see, the 14th, we did have our MICA meeting. We couldn't make that, Kip and I. That was virtual. Then we had the board's work session on the 20th. Did have an affordable housing meeting. We had that at the Pioneer Bank, the new Pioneer Bank, and there's room there that they let people use.
Wow.
And they have refreshments there, and so I don't know how often we can do that, but it was pretty nice. Then on Friday, the 23rd, we did have the MSSA Human Services, and that was a good program, the Yellow Ribbon Project. It took a big part of it, but it was worth it, and that was good to be in person. I didn't make the fair. I was going to get there the one Saturday. I had out-of-town commitments and things came up, but I see Kevin came through with flying colors as the rookie commissioner there, so that was good.
He's setting the bar pretty high.
Yeah.
Can
So,
I add something to Mark?
Sure.
Nancy from MICA was also at MSSA.
yes, I sat
Really
next to her,
nice
yes.
job.
Yeah, Nancy was there. She's the
Yeah.
contract lobbyist, yes.
Yeah, yeah.
And we were sitting next to each other, yeah, yep, that's
She
right.
does a nice
So-
job.
Nancy does a good
She
job
does.
for us, yeah.
Yep, so that went well. So that concludes my report, Mr.
All right.
Chair.
Thank you, Commissioner. Well, several of the things have already been mentioned. Planning and zoning I had, but we've already seen that. I had several legislative work groups in my SECB, which is taking up a lot of time. Luckily, we do all that by phone. Again, I'm still just learning a lot of that program, but getting educated as we go. I enjoyed doing that. At our MRCI executive meeting, same program as everybody else, we're looking for help. We are getting things spooled up, and we want to get back out into the community, so if you know anybody that's looking for a job like that, but again, as Vance mentioned earlier today, you know, it's a $15, $16, $17 an hour job is all, and a lot of competition for that market, so working very hard trying to get our vans out there. Had a JD 15 informational meeting for a ditch that we have this afternoon, but just 3 of us have to be at that, so you all won't have to participate in that. Mark mentioned Micah. We had our MVAC annual meeting, and we gave out all of our awards, and our Roger J. Wolf Award went to Laverne, who is actually a board member on the MVAC board. And she's just been very active in her community and on the MVAC board. And the last time that we decided to elect her, she was out getting hip surgery or something, and so we decided to elect her. And the interesting part of this story is we voted for her, and I was running a little late that day, and so I caught up with her as she's walking in, and like I normally would do, I was going to congratulate her on her award, and I get in there, and the staff all of a sudden comes up to me right away because they see me walking in with her. You didn't tell Laverne, did you? You didn't say anything, did you? I said, no, why? She goes, because this is a surprise. She don't know yet. So I just about blew the surprise just before we walked in the door. So, but she was very appreciative of the award. She does a great job, does a lot of volunteering in the community. Then again, I was at the fair for just a few hours. The other day we did our Farm Family of the Year presentation that Shane did, and Commissioner Pap and I were up there and handed them the award. It was a young family with 2 young kids, so really nice to see. Really nice to see. And
7th and 8th generation
yeah.
on that farm.
They've had people on that farm since
66.
Yeah, 1866. So pretty neat to see. Hung around at the fair for a little bit with Pat and Kevin, and then we also did the parade over Madison Lake, which was an extremely full parade of people everywhere. So they're getting out and about. I don't know how much candy we threw out, Pat, but we threw out a lot of candy.
Your granddaughters
So my granddaughters came with, and they had a great time throwing candy out. So that is my report, and that.
Well, there's one more thing. There's a birthday tomorrow that we have to recognize. Commissioner
cake?
Pap's birthday is tomorrow, and you know he's gaining on us old timers. So.
Do we want to sing in place of a former
Well,
commissioner?
you sing with me. I'm not like Commissioner Campbell was. I'm going to do it by myself.
Well, happy birthday, Kevin.
Happy
birthday.
yeah.
So that concludes our meeting today, but we will be going into a work session here at, let's do 10:40. So I would look for a motion to continue this.
Adjourn.
Adjourn.
Move to adjourn.
Second.
Any discussion? All in favor, say aye.
Aye.
All opposed, motion carries. Thank you, everyone.
I
Well,
had to get that into.
39.